Today's presentation we will discuss regarding what are the various techniques of inhalation and the inhalation anesthetics the drugs are given. First one, open drop method. There are generally two methods, open drop method and the second one is by using anesthetic machine. So in the first one, open drop method. So in this method, the drug is poured over the mask. Okay. So the drug is poured over the mask and its vapor. Vapor is inhaled with the air. So the drug is poured over the mask and its vapor is inhaled with air. So this is open drop technique of inhalation anesthetics. Advantages, coming to the advantages, it's simple and this method does not require any special apparatus because it is the open drop method. Only with the help of mask and the vapors just we have to place it and the vapors are inhaled by the patient, so it does not require any special apparatus and this method is simple, convenient. And disadvantages, coming to the disadvantages, concentration of the drug is not determined in this method. So this is the major disadvantages of open drop technique. And in preclinical studies, generally they adapted the open drop technique method for the evaluation of some drugs. The second one which is involved in the anesthetic is by using anesthetic machine. So this is the picture of the anesthetic machine. So in this method, the gases are delivered to the patient. Okay. So the gases are delivered to the patient and it is the gases supplied via the cylinder. So this is the machine. You will be having the cylinder attached and it is fitted with the valve. So graduated vaporizer. So the liquid or the gas is converted into the vapor and it is via the valve. It is and the vapors are supplied via the valve. And what is the main advantages in this method is mainly it is having more advantages when compared to the previous method, that is open drop method. Okay, this is having more advantages. The number one advantage is we can have the control of the drug which you are going to administer to the patient, and we can estimate or we can find out the concentration or how much amount of the drug is reaching, how much amount of the drug you are going to administer to the patient. Okay, we can have the control, we can increase or we can decrease the concentration, or we can increase or decreasing the anesthetic agent. And the next thing, one more advantage or significance of this method is respiration. So respiratory rate also it is under the control. So respiratory rate, if it is increased, it may lead to the problem. So we can have the control of respiration by using this anesthetic machines. We can have everything under the control, and these are the monitors, and this is the monitor by which we can find out the heart rate, respiratory rate, and with the help of the valves everything we can control the flow of gas, everything. This, so it is having more advantages when compared to the previous method. And in by using anesthetic machine we are having three methods, okay, in subtypes. So here also open method, the first one is the open method, the second one is closed, third one is semi closed. So by using anesthetic machine also we are having open method, closed method and semi closed method. So the first one, the fresh anesthetic mixture. Okay, so it is given along with some inert gas, or which will increase the concentration of the GA. So it has to given in combination. So the anesthetic mixture is drawn, the fresh anesthetic mixture is drawn each time. And by this method we are having the higher or increased flow rate of the given drug, okay, or given anesthetic mixture. We can attain the higher flow rate by this method. So fresh anesthetic mixture and higher flow rate we can attain by using this technique, open method. Closed method. In the closed method, the patient rebreathe the exhaled air. You know what is mean by inhaled and exhaled. So the exhaled air, gas or the air is again entering into the patient. Okay, so rebreathe the exhaled air, and the flow rate is low when compared to the previous method. In the closed method, flow rate is low or less, and it is used, we can regulate the flow, and it is useful for expensive drugs. And this method we can adapt for, or it is useful for expensive drugs like halothane, enflurane and desflurane. And in semi-closed method, partial rebreathing is allowed. So these are some of the techniques of inhalation anesthetics.